Your morning urine has too much foam. Stop ignoring that bubbly toilet water immediately and stop assuming it is just a sign of a strong stream. Instead, pay close attention to the texture of those bubbles. Did you know that the very thing you see every morning could be a silent indicator that your vital filters are under a massive chemical attack? We often think we are healthy because we feel no pain, but your bathroom habits might be telling a much darker story about what is happening inside your body. Proteinuria. This is a word you might have overlooked on your medical chart, but this single metric determines your future independence and longevity. It is not just a clinical term, it is a desperate SOS signal from your internal filtration system. When protein leaks into your urine, it means your kidneys are failing to keep the essentials in and the waste out. If you choose to look away now, the final destination is a life tied to a dialysis machine or total kidney failure. This is the reality for those who wait too long. I am Dr. Mattheus from Kidney Health 365. Statistics show that 1 in 7 American adults is living with kidney disease, yet staggering 90% of them are completely unaware of it. Why is this so common? Because the kidneys do not have nerves that signal pain until it is almost too late. You might think your fatigue, swollen ankles, or high blood pressure are just normal parts of turning 60, but this complacency is why we call it the silent killer. It erodes your health in total silence. So, how do you protect yourself before the damage becomes permanent? The answer starts at the root, understanding the specific causes and choosing the right nutritional path. In this video, I will break down the 5 most common reasons for foamy urine and reveal exactly which hidden dietary triggers are sabotaging your recovery. I will also share the golden habits that have been shown to stabilize these indicators and protect your nephrons. There is one specific health condition that acts like a slow-burning fire within your kidneys, and the foam you see might be the first smoke rising from that fire. Let us explore the dangerous link between your blood sugar and those bubbles in the bowl. To understand why those bubbles appear, we must look at the most common underlying cause for people over 55 diabetes. High blood sugar acts like a slow-burning fire inside your cardiovascular system. When your glucose levels remain elevated for too long, they begin to physically erode the microscopic blood vessels that feed your kidneys. This condition, known as diabetic nephropathy, is the leading cause of kidney failure in the United States. Think of your kidney as a sophisticated tea strainer. Normally, the holes are small enough to keep the precious tea leaves or proteins inside. However, chronic high sugar rips those holes wider, allowing large protein molecules called albumin to spill out into your urine. When albumin hits the water in your toilet bowl, it acts exactly like soap, creating a thick white foam that does not dissipate quickly. For many, this foam is the very first visible warning sign that their kidneys are struggling, often appearing years before any physical pain or exhaustion sets in. This is why the American Diabetes Association recommends that everyone with type 2 diabetes gets a microalbumin urine test at least once a year. According to the National Kidney Foundation, early detection at this stage can be the difference between manageable health and permanent organ damage. You can find more details on these clinical guidelines at kidney.org. It is a sobering reality, but knowing the truth gives you the power to act. While diabetes is a major player in this story, it is not the only reason you might see bubbles after you go. There are several other factors, ranging from simple lifestyle habits to environmental triggers, that can change the appearance of your urine. Let us break down the 5 primary reasons this happens so you can determine exactly what your body is trying to tell you. The most significant and serious reason you might see foam in your urine is a condition known as proteinuria. To understand this, imagine your kidneys are the most advanced water treatment plant in the world. Inside each kidney are millions of microscopic filtering units called nephrons. These nephrons act like a very fine mesh or a sieve. Their job is to keep the essential things your body needs, like large protein molecules, inside your bloodstream while allowing waste products and excess water to pass through into the urine. Under normal circumstances, protein molecules, specifically one called albumin, are simply too large to fit through the holes of a healthy kidney filter. However, when the kidneys become damaged or inflamed due to chronic conditions like high blood pressure or diabetes, those tiny holes in the filter begin to stretch or tear. This allows the protein to leak out of the blood and into the urine. When protein molecules hit the water in the toilet bowl, they change the surface tension of the liquid. This creates a thick, persistent foam that looks very similar to the head on a glass of beer or the suds from dish soap. Unlike normal air bubbles, this protein-rich foam will often remain in the bowl for several minutes, even after you finish. According to the National Institute of Diabetes and Digestive and Kidney Diseases, having protein in your urine is one of the earliest clinical signs of chronic kidney disease. This is a critical warning because you cannot feel your kidney filters tearing. There is no pain associated with this leakage. The appearance of foam is often your only visual clue that your internal filtration system is failing. Research published in the Journal of the American Society of Nephrology indicates that early intervention at the stage of proteinuria can significantly slow the progression of kidney failure. You can find more comprehensive data on these studies at nid.ni.gov. If you notice that this foam is a consistent part of your morning routine, it is a sign that your body is losing its building blocks. Every gram of protein that ends up in the toilet is a gram that should have been used to repair your muscles and support your immune system. While this is the most concerning cause, it is important to remember that not all foam signifies a medical emergency. Sometimes the way the bubbles form has more to do with the laws of physics than the health of your organs. Let us look at how the sheer force of your bathroom habits can sometimes create a false alarm. While protein leakage is a major concern, it is important to distinguish it from a very common physical phenomenon, the speed and force of your urinary stream. Many people, especially those over 55, may find themselves holding their urine longer than they should, perhaps during a long car ride or while watching a favorite movie. When you finally reach the bathroom, your bladder is overfull and under high pressure. This results in a rapid, powerful stream that hits the water in the toilet bowl with significant force. Just like turning on a high-pressure garden hose into a bucket of water, this impact naturally traps air and creates bubbles. The key difference here is the lifespan and appearance of these bubbles. Bubbles caused by sheer velocity are typically larger, clear, and very unstable. If you watch closely, you will see them begin to pop and disappear almost immediately after you finish. Within 30 seconds to a minute, the surface of the water should return to a relatively calm state. This is a simple law of physics and is not a cause for medical alarm. It does not mean your kidneys are failing. It simply means your bladder was working overtime to empty itself. However, many health experts advise against making a habit of holding your urine for extended periods. According to the Urology Care Foundation, frequently overextending the bladder can weaken the bladder muscles over time and increase the risk of urinary tract infections, which can indirectly stress the kidneys. You can find more information on bladder health at urologyhealth.org. So if you see bubbles that vanish, quickly take a deep breath and relax. But if those bubbles are accompanied by a concentrated color or a strong odor, we may need to look at how much hydration your body is actually receiving. The third most common reason for foamy urine is something that affects millions of Americans every single day: dehydration. As we age, our body's thirst mechanism becomes less sensitive, meaning you might be dehydrated without even feeling particularly thirsty. When you do not drink enough water, your kidneys perform their job by conserving as much fluid as possible. This results in urine that is highly concentrated with waste products, minerals, and salts. Concentrated urine has a higher surface tension than well-hydrated diluted urine. Because the ratio of solutes to water is so high, it becomes much easier for bubbles to form and linger when the urine hits the toilet bowl. You will often notice that this dehydration foam is accompanied by a much darker color, ranging from deep yellow to amber. This is your kidneys' way of shouting that they need more fluid to flush out the daily accumulation of toxins efficiently. When your urine is this thick, it puts an extra mechanical strain on the delicate structures of your renal system. According to data from the National Academies of Sciences, Engineering, and Medicine, adequate fluid intake is essential for maintaining the solubility of minerals in the urine. When you are chronically dehydrated, those minerals can not only create foam, but can also begin to crystallize, leading to the formation of painful kidney stones. A simple way to check this at home is to significantly increase your water intake for 24 hours. If the foam disappears as your urine becomes lighter in color, you have found your answer. For more clinical details on hydration requirements, you can visit nap.nationalacademies.org. Understanding these physical and lifestyle factors can save you a lot of unnecessary stress. But even if you are well hydrated and the stream is slow, there are external factors that can play tricks on your eyes. Let us explore how the very products you use to keep your bathroom clean might be causing a confusing chemical reaction. The fourth reason you might see foam in your urine has absolutely nothing to do with your biological health and everything to do with the environment of your bathroom. We often forget that the modern toilet bowl is not just a basin of plain water. It is often a cocktail of various cleaning agents, bleach, and deodorizers. When your urine, which naturally contains urea and other ammonia-like compounds, hits these chemicals, a rapid chemical reaction can occur. This reaction can produce a bubbling or fizzing effect that looks exactly like foamy urine. Many people over 55 are very diligent about household cleanliness, often using automatic blue or green toilet pucks that release cleaners with every flush. These specific products are designed to foam slightly to show they are working, but they can easily create a false sense of alarm when you look down after using the restroom. To determine if this is the cause of your concern, there is a very simple and free test you can perform at home. Try urinating into a clean disposable plastic cup or a separate container that has not been treated with any detergents or bleach. If the urine in the clean container remains clear and free of foam, then you have your answer. It was just a chemical reaction in the bowl. This simple step can save you hours of anxiety and unnecessary worry about your kidney function. According to consumer safety data from organizations like the Environmental Working Group, many household cleaners contain surfactants specifically designed to lower surface tension and create suds. You can learn more about how these chemicals interact with organic waste at ug.org. It is always better to rule out environmental factors before assuming there is an internal medical issue. However, even if your toilet is sparkling clean and you are well hydrated, there is one more external factor that can alter the appearance of your urine. Let us look at how the very medications you take to stay healthy might be playing a trick on your eyes. The fifth and final common reason for foamy urine involves the medications or supplements you might be taking. As we navigate our 50s and 60s, it is common to be on a daily regimen of prescriptions for various conditions such as urinary tract infections or chronic pain. Certain drugs are designed to be excreted through the kidneys, and as they leave the body, they can significantly change the physical properties of your urine. For example, a very common medication called phenazopyridine, which is used to relieve the pain and urgency of a bladder infection, is famous for turning urine a bright orange color and giving it a distinct soapy foam. Similarly, some types of antibiotics or even high-dose vitamin supplements can alter the concentration of solutes in your urine, making it more prone to bubbling. It is also important to consider over-the-counter supplements. Many people take high doses of protein powders or certain amino acids to maintain muscle mass as they age. If your body cannot utilize all the protein you are consuming, the excess is filtered out by the kidneys. This overflow can create temporary foam even if your kidneys are perfectly healthy. According to the U.S. National Library of Medicine, always checking the side effect profile of your medications is a vital part of self-care. You can look up specific drug interactions and urinary side effects at medlineplus.gov. If you recently started a new medication and noticed a change in your urine, it is very likely a temporary side effect of the drug's excretion process. Understanding these 5 reasons gives you a comprehensive toolkit to analyze your own health without panic. Most of the time, foamy urine is a manageable issue related to hydration, physics, or environment. However, we must never lose sight of the fact that the kidneys are silent operators. While foam can be harmless, there are specific red flag signals that, when combined with foam, require immediate and professional medical attention. Let us look at the critical warning signs that tell you it is time to stop observing and start acting. When observing bubbles in your urine, you must look beyond the toilet bowl to see how your entire body is responding. The most urgent red flag is unexplained swelling, also known as edema. If you notice that your socks are leaving deep indentations in your ankles, or if your eyelids appear unusually puffy in the morning, this is a major signal. It suggests your kidneys are no longer effectively removing excess sodium and fluid from your blood. When protein leaks out, it creates an osmotic imbalance that forces fluid into your tissues. This is not just a cosmetic issue. It is a sign of internal, systemic pressure. You should also pay close attention to any changes in the color or clarity of your urine. If the foamy water is accompanied by a pink, red, or cola-colored tint, it may indicate the presence of blood, which requires immediate clinical evaluation. Furthermore, if you begin to experience persistent shortness of breath, a metallic taste in your mouth, or a sudden loss of appetite alongside foamy urine, your kidneys may be struggling to filter out metabolic waste products like urea. According to clinical data from Mayo Clinic, these symptoms often point to a significant decline in glomerular filtration rate. You can find detailed symptom checkers at mayoclinic.org. If you have diabetes or high blood pressure, do not wait for these red flags to appear. Early stages of kidney damage are often invisible to the naked eye. The only way to be certain is through a simple urine test for microalbumin and a blood test for creatinine. By catching these changes early, you can implement lifestyle and nutritional adjustments that protect your independence. Now that we understand how to read the signals of the body, let us look at how you can take these lessons and turn them into a long-term plan for vitality. We have journeyed together through the science of your body to understand that foamy urine is not always a cause for panic, but it is always a call for attention. From the physical impact of a strong stream and the simple fix of hydration to the more serious signs of protein leakage and the hidden effects of diabetes, you now possess the knowledge to decode your body's silent language. Remember, your kidneys are the ultimate filters of your life, and keeping them clean is the secret to lasting vitality. Time is of the essence, because kidney issues are master of disguise. They often progress quietly in the shadows, and by the time obvious pain or symptoms arise, your delicate filters may have already sustained significant damage. This is why looking at the bowl today and taking action tomorrow is the most important decision you can make for your future independence. Do not wait for a crisis to start caring for the organs that work so hard for you every single second. I want you to know that it is never too late to make a difference. Even if you have struggled with your health in the past, your body has an incredible capacity to stabilize and improve when given the right support. Every healthy choice, every extra glass of water, and every mindful meal is a victory. You have the power to change your health narrative, and I am honored to support you on this journey toward a longer, more vibrant life. As a practical next step, I encourage you to perform the clean cup test we discussed, or simply commit to drinking 2 extra glasses of water tomorrow morning to see how your body responds. These small, simple actions are the building blocks of a masterpiece of health. Please keep in mind that the information shared today is for educational purposes only and should not be taken as personal medical advice or a substitute for a professional diagnosis. Always consult with your doctor or a renal specialist before making any major changes to your diet or medical routine, especially if you have pre-existing conditions. If this video helped clarify your concerns, please subscribe to Kidney Health 365 and hit the notification bell so we can continue protecting your health together. To take the next step in your recovery, click on our next video, Foamy Urine, 4 Fruits and Daily Habits to Protect Your Kidneys, starting today. I will see you there to continue our mission of health.